are back with Brunch, a taste of Tobago. Now, before we went to break, I indicated to you guys that Dr. Mcsween is back on the Brunch set, and we are going to get into some conversation. We were actually speaking before the break because, we talk from time to time. And, one of the things that we're going to be talking about, demystification of chiropractic medicine. We're going to delve into that just a bit. But before that, let me welcome Dr. Mcsween to the show
it's good being up here in Tobago today.
And remember the last time you were here, I told you, oh my gosh, you have to be back.
Yes.
Because I felt like we were not finished.
Oh, there's so much to talk about.
Yeah, I felt like there was so much that we still need to touch on. So I just want to thank you for being here, and thank you for always giving us the knowledge that we would not get had you not been on this show. Yeah.
Okay.
So I know that you have some stuff to show us. We actually have
a video. Yes.
Yes. So we're gonna cue the video, guys. We're gonna have a look at the video,
and we'll go through why it is dangerous. What you see in the video.
Okay. So videos, X-rays, the whole works. All right. Okay. So we're going to cue the video and we're going to talk about the X-rays as Dr. Mcsween just indicated, and also the pros and the cons, because we always have to go into the pros and the cons, the do's and the don'ts.
Sure.
Yeah? Okay.
So how are you feeling today? What's going on?
Not bad, just my tightness in my mid-back. I haven't been adjusted in so long either, so I was like, I have some...
Has it been since the last time you were here, probably?
Probably.
All right, drop the elbows down.
That's my favorite. I love that one.
Yeah, okay. Let's do low back. Wow. Wow. So just take a breath in, let it out.
Oh my god. I don't know what I thought that was, but that was not it. I mean, it feels good. I just wasn't expecting that.
Yeah?
That was nice.
Catch you off guard a little bit?
Yes, a lot.
Let's see if we can get anything else.
Oh, there we go.
So good.
There we go.
So how about that towel adjustment?
It was actually really nice after the fact. It scared me when it was happening, but it feels good.
It was good?
Yeah.
Awesome. All right.
Thank you so much.
Sure.
Oh my gosh. You need to tell me about what just happened there, because I'm hearing like the cracking sound.
Yes.
Oh my, what was going on?
That is not chiropractic. I didn't learn that at my alma mater. As you can see, he just held her and started to twist her and all this kind of stuff. She's going to become worse over time. We're going to look at an X-ray and I'll show you why I say that. You must look at the vertebral subluxations. Remember when we started the program, we spoke about what is chiropractic. And chiropractic is the art, science, and philosophy of vertebral subluxation. What is a vertebral subluxation? It's when one of the spinal bones move out of juxtaposition with the bone above or below it. So if you have such a patient and they come into you and you just start to twist them and turn them and bend them, and they could have a host of problems in their spine, you will make them worse. That's like a Mack truck coming and just hitting you while you're in traffic and your neck goes this way and you suffer some whiplash. It's no different than what he did. That's not chiropractic.
Yeah, and I see...
Wouldn't you be scared to go and have something like that?
Yeah, I would be scared.
Of course.
I'm hearing it's the cracking sound for me.
It's injuring people, and people are accepting that. So we have to demystify that. We want to say what chiropractic is and what it's not. My alma mater, 2 universities of chiropractic, Pennsylvania College of State Chiropractic, and there's a chiropractic university that they just twinned up with in Spartansburg, South Carolina. I was taught that X-rays are essential to analyze the movement of those bones.
Right.
If you have one bone out of place in the neck, it can paralyze your arm.
Oh,
So if
yeah.
you go into someone and they twist you and turn you like how that young man did, left and right,
Yeah.
and not visualizing the bone that has gone out of place or out of misalignment, you're injuring the person. You're making it worse.
Yeah.
I came up here Friday and I saw an emergency patient on Friday. And that is one of the problems I've had when I came up. And that is the young man went somewhere in Tobago. He had his x-rays. Whoever he went to did not analyze the x-rays and just went into his back and put machine in him and all kind of stuff. That is not chiropractic. You got to identify those subluxations. Anyway, the young man came to me. He brought the x-rays, thank God, because I knew his mother previously. And I analyzed the x-rays. He had numbness on the side of his face coming out of that incident with the person he went to. We have to say that you cannot just watch a person and put your hands on their back, and you don't know. You don't know. And remember I told you in one of our conversations that people come into me, and I find there's a preponderance in Trinidad of this issue, and they come in with back pains, and the cause of it is trauma. And 2 out of 3 of my patients have never had an accident.
Yeah, but yet they come in with.
I practice in Port of Spain, I practice in Tunapuna, I practice presently in South. I had 3 offices, and my head office is in South now. And the population in San Fernando, as I said, 2 out of 3 of my patients come in non-accident patients, but they have been going to people who walk on the back and do all kind of stuff to them.
Yeah.
Young woman just came to me from an insurance company, went to a chiropractor, and she became worse. Why? They haven't sent for x-rays, and they're just getting on the back. So I say that this is something that we must take notice of, and we must change that. There must be some standard of how and what you can use to facilitate your care, and not just put your hands on the patient's back.
Definitely.
Because you're injuring them.
Yes. And making bad matters, if there are bad
I'm
matters,
making it worse.
making it worse.
You see what he did with
That's
the both
the
sides?
thing. Yeah.
Did you see the both sides?
It's the
Now I'm going to
cracking.
show you an x-ray that tells you that he is totally out of it. He's out of lunch. Can we see that x-ray so we can get into it?
Yeah. But just before we go into the x-ray, you guys queue up by the time. But before we go into that, are too many people buying into what just happened on
Of
the
course,
video
it's
there?
propagated by a system. That's
Yeah.
why it's propagated, and people don't know. You remember he said, "You don't know that you don't know."
Yes. And we have the x-ray.
We don't know.
You have
And we
to
say,
do
you know
your
something, but
x-rays.
I went by
Yeah.
this guy, but God, but he put me there and I feel a little good, but he's injuring you over time. The nervous system feeds everything.
Definitely.
And by doing that, you're injuring your client, and the client does not know.
Yeah.
Now, a patient comes into you as a chiropractor. It's absolutely necessary to get x-rays at first, because you want to know what the problem is. What are you dealing with?
And you want to see exactly what's
You want to
going
see what's
on.
happening. You have
Yeah.
what is called vertebral subluxations. You have compensation subluxations as well. A bone move out of place, and another 1 or 2 may move because of that movement to render the client ease. Ease now.
Yeah.
Not making you well, but because of how you walk and your gait and so forth, those bones would move because of that particular bone, which is the primary subluxation. So the chiropractor must be skilled sufficiently to get in there and identify what is the major subluxation here and
Yeah.
correct it. And those compensation subluxations moves to follow.
Yeah. So, for instance, the X-ray, we're going to take a look at the X-ray that you brought with you, and really delve into what is happening
Yes.
in that X-ray, because
that
I
spine.
know in that spine.
Yes.
Because a lot of people are doing just what you said.
They are.
Going here, there,
Everywhere.
everywhere.
Everywhere. And the last time you spoke about bush bath and drinking this and
Yeah.
rubbing with this. It doesn't work that way. And there's no mysticism in it. There is
Right.
no spirituality in it. It is a straight structural issue. Because God made us that way. Without a neural plate, there will be no brain, there will be no spinal cord, there will be no spinal bones. And that neural plate must develop from embryogenesis to the point where it makes you.
Definitely.
But
I get you.
when you look at one of my films, you'll see that all the nerves are coming from the spine that's feeding everything else.
Yeah. So let's see. Let's go back to the X-ray, guys. Let's see. Now it's an X-ray of the spine.
It's an X-ray of the spine where patient never saw a chiropractor.
Right. So this is
Right.
it.
This
here.
is it. Now you can see if you go into that guy and your spine is like this, that's trouble.
Yeah.
That's trouble. Look at how the spine is twisted down in the lower back. Look how it's twisted. We're going from L1 down to sacrum. It's all rotated. And there's a certain type of rotation in that spine. The spine it has what is called a dextro scoliosis. It's on one side, it goes on the other side. But down in the lower back there is the issue of assisting this patient. You
Right.
must know how to rotate those lower back bones. Now, let's just say that you go on to the same guy who we just spewed what he is doing.
Right.
And he goes on both sides of your spine, down in your lower back, because we saw him do it. He put the person on his, man, he licked her up.
Yeah.
And this person never had seen a chiropractor. But guess what? We have a lot of backyard chiropractors in Trinidad. And that is one of the reasons I think I see so many clients coming into me without having been in blunt force trauma with respect to an accident, auto accident, having that type of problem.
Yeah.
Because
And-
everybody wants to walk on your back.
yeah.
And everybody knows they could do this. I will fix you up. And that kind of thing. It doesn't work that way.
Yeah. And if someone comes in, let's take, for example, the video that we just saw, and someone goes into a practitioner with that condition of spinal
Right,
deformity.
exactly.
We talking paralyzed
We're talking about paralysis.
when we finish?
We're talking about paralysis. As I mentioned earlier on, this young man came into me. He was getting numbness after leaving where he went all the way. His mother said, "No, I'm taking you to Dr. Mcsween. He's going to fix you up." And I came up and I saw him. And in fact, yes, the x-rays indicated that. But whatever the person did to his neck made him worse because the numbness started developing. So I fixed him up. He's back at UE now. I saw him 2 days and he's good. He's 20 years. We must learn now to demystify the whole concept of what chiropractic is about. Chiropractic is a structural problem. It's basically
Yeah,
structural.
basically.
No spiritism or spirituality in that thing. Nothing like that. You know,
Contrary to
contrary
popular
to what we
belief.
believe.
Yes.
Yeah, but Sister Mary, she real good, Sister Mary had no iota of clinical experience to do that, and it's sad. It's sad, and people accept it.
Yeah, and it's.
I want to
it's-
say something that I
Yeah, go
shouldn't
ahead.
say, but I will say it. Right? I came back to Trinidad about 27 years ago, and someone came to me. I mean, I shouldn't say this thing, but sometimes you gotta clarify some stuff. This thing should be in the university at the tertiary level. The person came to me and said, "Doc, the Prime Minister has some back problems. Would you see him?" I said, "Well, sure." So every Wednesday I went to La Fantasia and I saw the Prime Minister and his wife. Now, I am saying that having had that knowledge and having had the care that I gave you. But do something. Because it's not here. It's not at our university. Chiropractic is not about rubbing. Chiropractic is dealing with that structural problem that exists in the spine. So do something about it. My focus was never to influence. I went to give him care.
Yes.
And not only him, he and his wife got care from me.
There you go.
So hey, we should not be at this stage where we have to demystify chiropractic.
Yeah.
And that's what we're doing this morning.
Yeah, and I like the fact that you said we should not be at that stage.
We should not be at this stage.
We're going to take a break because you see this conversation, we have to take a break and come back. Anytime Dr. Mcsween is here is always a vibe. We will be right back with Brunch, a taste of Tobago. We are back with Brunch, a taste of Tobago. I was talking with Dr. Mcsween during the break, and we are still speaking on the demystification of chiropractic medicine. Now, I was very scared looking at the video.
Yeah.
And I felt some sort of feeling, just that cracking noise. That was it for me.
Some people like to hear the cracking now.
Yeah, that the cracking, that was it for me.
Well, you hear some of that in my office too, of course. But when I address you, it is with perspicuity. I'm very clear as to what I am doing. I'm not doing any more than I do not have to do.
Right.
Because the whole object there is to get that patient well.
Definitely.
So it's not about the patient coming in and say, well, I'm paying you this, and then you just do any old thing. That is not what chiropractic is. I didn't learn that from my undergraduate and graduate schools. I haven't learned that. And I can't practice like that because I'll be doing a disservice to my patient.
Right.
I'll be making my patient worse. And let's look at the x-ray and you see what I'm talking about in reality. And this is a real issue too. Remember we have a couple of the x-rays. We want to get on that x-ray first.
Okay. That's the spine. We're back with the spine.
We're back with the spine.
Right.
And now here it is that I can tell you bones that are out of place in the spine.
Right.
By T1 is rotated. T1 is rotated left. T2 is rotated left. T3 rotated left. T4, T5. And we go further down. You have T11 rotated right. You have T12 rotated right as well. And you have L1 rotated right. Now, these are things that the chiropractor must know.
Oh, yes.
Because you have to analyze the spine to identify that. And if you don't, you have no magical eyes to show that to you.
Hence, doing the x-ray so you can see what's happening.
Exactly. So they inflict trauma to the client, and the client doesn't know. They didn't know any different. And so they go for it. And it's hurting them over time. I see hundreds of patients in Trinidad that way. I have not seen this problem in Grenada because there's nobody jumping on anybody back in Grenada. And I've seen it to a less extent in Tobago, as I told you previously.
Yes.
But Trinidad is rampant there.
Yeah, but what is the conversation like with regards to chiropractic medicine? Do you see persons getting involved in this field of practicing?
Yeah, well, there are people who call me and inquire and so forth about becoming registered in school. Of course, I've told them the requirements for all chiropractic university. You must have a Bachelor of Science. All right. With my patients, the conversation is there. But we have no one who says, okay, we need a certain standard to perform chiropractic. Without those standards, You're not doing anything to help the populace. You're not doing anything to help our people. We need those standards. Those standards must be set. You have adjuncts you could use in your practice. You may want to massage a bit. That does not dissolve the issue on this vertebral subluxation. It remains until you physically put it back. I cannot put any machine on your back to fix your back. I cannot take any machine and shock you. I mean, when I couldn't walk, I used to live with a TENS machine, 2 of them on my waist. It used to shock me 24 times 7. That did not help me. I crawled around with 2 TENS machine on my back for nearly a year. So we need to develop that conversation, and we need to change it. Because without changes, it's going to persist and it's going to continue. And I'll continue to say it's wrong.
Yeah.
You know, but I'll continue to practice the right way and the correct way.
And I love the way you said that. Continue to practice the right way, the correct way. Now, you guys notice those words because there are quite a few, just as the video that we just saw. There are quite a few persons doing that sort of thing.
I've been to a fair, and when I walked on the fairground, there were guys there, you know, like bodybuilders, offering people to give them chiropractic care. The people in the fairground, they didn't come with x-rays, but because of that concept of what it is, they expose themselves to that brutality. And it's sad. It's really sad. And those who do it find pleasure in it because the person, oh, you know, I feel good. But 2 years down the road, they come in my office. And when I send them for x-ray, did you get x-ray? Did the chiropractor send him for x-ray? No. Did the chiropractor do findings on your x-ray? No. Like when I send for x-ray, I usually get a report. The chiropractor need to do that as well. The chiropractor need to do a comprehensive analysis on the x-ray and what he sees or she sees as a chiropractic problem. Not the normal information that you get from the x-ray technologist that tells you about you may have osteophytes or your end plates are okay, there's no destruction, or there might be some arthritic thing here or there. It's different. Chiropractic analysis is totally different.
Yeah. And you know, that is why one of the reasons that I love doing this show, because of the information. There's always something to absorb.
Yes.
And having you here, because the conversation was almost null and void when it came to chiropractic medicine and the do's and the don'ts and that sort of thing. And so having you on has been, you know, so enlightening. And I know there's so many people who are looking for answers. There's so many people who are still skeptics and would not want to come
no, they're
to
not
the
coming.
chiropractor.
No, not at all. Not at all. I have a patient recently, about 3 weeks ago, came in and said he wouldn't come and see me as a chiropractor because he had a friend who went to someone in San Fernando, and and I think it's 5 days after they saw the chiropractor, they died. Now it may have been some other cause now.
Yes, it's quite a lot, and I think you're dealing with a cultural kind of existence as well.
Yes,
and
absolutely.
so you have to delve all the way through that. That's a whole other vibe.
We've been taught that.
It's a whole other vibe.
I grew up on Picton Road, Laventry, by the tanks and stuff as a young man, and I know if something happened, you have the neighbor who would want to fix you up.
There you go.
Never had a day in school, you know, but he want to fix you up. You know, I'm taking you by Mr. So-and-so, or I'm taking you by so-and-so. Thank God my mother was too sensible for that stuff.
Right,
exactly. So any fixing up, she used to do it.
And you know, it's always a pleasure having you. Thank you so much, Dr. Mcsween, for being with us. We're going to take a break, guys. But you know what? Before I do that, let me just mention the trivia question for today. What is the name of the oldest fort in Tobago? You guys start typing, and we're going to be right back with more Brunch Taste of Tobago. Or I on Bagel Feet It is up next. The BT joins us. We'll be right back.
Mount Pleasant Credit